is a combining form describing pneumothorax and hemothorax. Pneumothorax is caused by air in the chest cavity, and hemothorax is caused by blood in the chest cavity. The prevalence of this condition is that it can affect anyone, but it is the most common caused by trauma.
For the anatomy, it has the pleural cavity, and it is a thin fluid-filled space between the two pleural layers, the visceral and the parietal layer. The visceral layer is the inner layer that covers the lungs and the adjoining structures. Parietal layer is the outer layer that is attached to the chest wall, and the pleural fluid is the fluid found between the layers. For the physiology, the pleural cavity helps each lungs function while they're breathing. For the visceral pleura, it covers each lungs and dips into fissures between lobes. Parietal pleura attaches to the inner surface of the thoracic cavity and separates the pleural cavity from the mediastinum. And the pleural fluid functions as a lubricant between the visceral and parietal pleura, allowing both to guide smoothly during inhalation and exhalation.
Etiology, or the causes, would be chest trauma, blood clotting defect, chest thoracic or heart surgery, death of lung tissue, pulmonary infraction, lung or pleural cancer, primary or secondary. Tear in the blood vessel when placing a central venous catheter or when associated with severe high blood pressure and tuberculosis.
Okay, so the pathophysiology is bleeding into the pleural space, which can occur disruption of the tissues of the chest wall and the pleura. Hemodynamic response varies on the amount of bleeding and blood loss. So if you don't bleed a lot, there's no symptoms, but if you bleed a lot, it can cause shock, like tachycardia, tachypnea, and the decrease of blood pressure. Respiratory response. If there is a large accumulation of blood within the pleural space, it can affect normal respiratory movements. In more severe cases, abnormalities of ventilation and oxygenation can occur. If there is a large amount of blood, it can also cause dyspnea and later result into tachypnea. The volume of blood required to produce these symptoms in a given individual varies depending on a number of factors, including organ injury, and the severity of the injury.
Hi, how are y'all? I'll be the nurse with y'all today. So I had a few questions for Mr. Williams. Has he had chest pain, especially when breathing? Alright. Has his skin been cold, pale, or clammy? Yes. Has he had rapid heart rate? Has he had low blood pressure? Rapid or shallow breathing? Alright, difficult breathing? And what about anxiety? Alright, well thank you. I'll have a nurse come in a minute. Alright, so these are some of the exams we could do on Mr. Williams. An x-ray, which is an image of the chest, which will reveal if there's liquid in the chest cavity. In an x-ray, the lungs will show up black, where the pleural fluid and any blood in the chest cavity will show up white. A CT scan, this can give doctors a complete image of the lungs and pleural cavity, which may be especially important in cases of injury. A full CT scan of the chest can often reveal the cause of the hemothorax and the best treatment for the individual. An ultrasound, which in emergency situations, ultrasound images provide a quick and accurate look into the pleural space for potential damage and hemothorax. So, after looking at these three, I think the x-ray will be the best one we should do on Mr. Williams.
Yeah, I think we should do the x-ray.
Alright, we'll x-ray, we'll do it. Okay, Mr. Williams, we're going to do an x-ray on your chest.
How are you doing today, Mr. Williams?
I'm okay.
Well, today the treatment of the hemothorax condition that your husband has brought in today mostly will be the insert of a chest tube.
Okay.
basically between the chest walls that the ribs, so that we can drain, which it will be on for several days.
Oh, okay. That's
Yes,
cool.
The chest tube will basically remove fluids, the pus in his chest, the air,
Okay.
and the blood. Basically, an incision made into the chest, between the clear space of the chest.
Okay.
And it is performed by surgeons to gain access to thoracic organs.
Oh.
Mostly common close to the heart of the lungs and the esophagus.
Alright.
And this is basically for the access to the thorax and the anterior spine to drain all of the blood.
Okay.
How are you doing today, Mr. Williams?
I'm doing well. How about you?
I'm doing fine. I see you look much better.
I feel a lot better.
Yes, sir.
Hemopneumothorax is the blood and air in the chest cavity. It can affect anyone, but is the most common in trauma causes. Some of the signs of hemopneumothorax is a rapid heart rate, low blood pressure, tense and rapid shallow breathing. One of the treatments is inserting a chest tube into the chest wall between the ribs to drain blood, air. Another treatment is thoracotomy, which is by making an incision into the chest wall to gain access to the thoracic organs. In my opinion, I believe that a serious condition that should be treated is known as hemopneumothorax.